All right, welcome everyone. This is Cassie Sauer. I'm the CEO of the Washington State Hospital Association. Thanks so much for joining us on this different day due to the President's Day holiday. Hope you all enjoyed a snowy 3-day weekend. We're really excited to have some great panelists today, and we have some interesting news to share. That maybe I'll share the news right at the top of the
Cassie, can we pause for a second? Ryan, we just had somebody chat that they do not have permission to record.
Okay.
We're just going to pause for
a minute. Ryan, I think probably everybody wants that. So if you could.
We thought we'd fix this issue, but apparently we haven't. So we'll get on it and give everybody permission.
Well, we'll just pause for a moment and while Ryan works on getting everybody permission. Ryan, let me know when we're good. Are you ready?
Unfortunately not, Cassie. I'll just be one moment.
Okay, thanks. Sorry, everybody. We're working on giving everyone permission to record. It's going to take us a minute.
Okay, I'm terribly sorry for the inconvenience. We're going to have to restart this instance of the meeting. If everybody could just quickly pop out and jump back in, we'll be able to get started right away. Again, sorry for the inconvenience. Please pop out, exit the meeting, and come back in. We should be able to get everybody set for recording.
Okay.
Thank you.
Thank you.
Everybody is being let back into the meeting. As you're getting let back in, you will be assigned permissions to record.
Do we have folks back, or should we wait for a moment?
I would say just one more brief moment. Again, terribly sorry for the inconvenience.
And can those of you that are recording just confirm for us that it's working for you?
Huh. Allison says it's not working for Cairo.
Yes, unfortunately not quite down to Cairo yet.
Okay.
Again, this will just take one moment. Thank you so much for your patience.
Ryan, is the setting allow to record local files?
Yes. So,
do we help you with that, or have you gotten through it?
I'm right at the middle right now. So, yes. Terribly sorry. Again, how we had it set was actually to just allow for the recording of local files. For some reason, it didn't work for some. So again, terribly sorry. We should have this corrected for the next time.
I'm going to go through and do some as well, Ryan.
Sure. Thank you very much.
Okay.
We should be good to go at this point.
Okay, great. All right. Sorry, everybody, about that. Okay, so now we will restart. Thank you all so much for joining us today. We're really glad to have you. Thanks for joining us on this different day. We've got some great panelists, and I think before I do the panelists, I'm going to start with just a piece of news, which is that vaccine shipments are delayed around the country because of the many airports that are closed. So Moderna especially seems to be impacted by this. So we're still waiting to get, the CDC apparently is going to do an update later this afternoon with some shipping updates, but that there may be some appointments that get canceled today or tomorrow as we're waiting for the Moderna to come in. We're hopeful that it might show up tonight, but that's there's a ton of closed airports around the country, and some of those are the airports that have typically been used to ship out the Moderna or to ship out all the vaccines. So we'll see about that and what's going to happen. So we're really glad to have great panelists with us today. We have Jeff Ritchie, who is the CEO of Airlift Northwest at UW Medicine, and we thought it'd be really interesting to hear about what was involved in transporting COVID patients as they did throughout the pandemic. And I think that's largely fallen off at the moment because there is plenty of capacity in hospitals around the state, but that'd be great to hear about. We have Dr. Michael Anderson, who's the Chief Medical Officer at Virginia Mason Franciscan Health. I gotta get the name right. And can talk about what they're seeing in treatment and variants, what's the current concern and what people should be doing to keep themselves safe. We also have, we can give an update on the counterfeit masks, and we have some new resources to share today about equity and vaccine, and a new dashboard that we think will help with planning for equity and vaccine administration. So that's what we're planning to talk about. If there's other things you want to talk about, as always, we're happy to take questions. So I think I'll start with you, Jeff, to talk about your experience at Airlift transporting COVID patients around the state. And I just want to remind people that I think some other states did this after we did, but we were the first state in the country to have a written agreement among all hospital CEOs that no individual hospital or individual region would reach crisis standards of care, that we would all work together to move patients, staff, medications, supplies, ventilators, whatever was PPE around the state to be sure that every patient was cared for. And many, many other states did have individual hospitals or regions, even some that were 5 miles apart, reach crisis standards of care. Crisis standards is where you're basically rationing care, triaging who's most likely to survive, and treating only them. So we're really grateful for the work, Jeff, that you all did to move patients around to make sure that that was the backbone of being sure that this commitment could be honored. So the fact that every patient in Washington State got treatment, I think is just remarkable. So Jeff, over to you.
All right. Well, thank you very much, everyone. Just quick, Jeff Ritchie, Executive Director for Airlift Northwest. I'm actually also the Associate Administrator for Laboratory Medicine and Radiology at the University of Washington Medical Center. I put together some slides about our experience here, and it's really kind of coming up to a year now that we have been in this operations. And in fact, actually, I started as the executive director at March 1st of 2020. So it was a good time to start a new job right in the beginning of a pandemic to be able to lead this incredible organization at Airlift Northwest. So why don't we just go to the next slide here. So just a kind of a quick overview of Airlift Northwest. So we are part of UW Medicine. This is a badge that we wear on our flight suits. It's saving lives together. And just a quick operation. So we have fixed wing base plane in Juneau, Alaska. And then we also have bases in Washington, which is in Arlington, Bellingham, Bremerton, Olympia, Seattle, Wenatchee, and Yakima. So our operations cover the entire state of Washington, plus in addition to our Juneau base up in Alaska. Our teams are made up of of 2 flight nurses with both pediatric and adult expertise. And then as part of our academic mission, being a part of the University of Washington, we are actually a training flight physician. So we have EMS fellows that are part of the Department of Emergency Medicine that train with us and actually on occasion are flying with us. So something that we bring to the table that is really incredible and really something I'm very proud of as being part of UW Medicine. The other piece is that we are a flying intensive care unit, and we bring blood, 2 units of packed cells, plasma on every single flight. And I know for a lot of the hospitals that are out there, having blood at each facility is not a large quantity to be able to have. And we bring that blood to the patient, and we've been doing that over the last several years. So when we started in this pandemic, we can just switch to the next slide. We really had to rethink the way that we were doing things, and it really came down to training. It's, do we have enough PPE for our flight nurses? And wearing a flight suit plus a protective PPE plus a mask and a flight helmet, you can tell you are wearing a lot of equipment, and you're also dealing with having that helmet on. And if you're wearing glasses, your glasses fog up. And so we are challenged in different ways to be able to take care of these patients. But we went back to training, and our medical director, Dr. Uranachid, Dr. Lynch, in consulting of how we would take care of these patients inside a helicopter or inside a fixed wing aircraft to be able to transport them safely. So that was the main focus, is making sure that we had enough medical supplies. And I'll touch on that here in another second. On the other piece is the employee health attestation. We wanted to be able to make sure that our employees are safe. And so what we did is we put in a process that every employee, when they come to work, is doing a health check to be able to make sure that they're healthy to be able to come to work from that side. And that's been innovation from our side that's actually on our phones. And so we can do that every single day to be able to do that. So that's at every base, that every nurse, pilot, mechanic are doing that every single day. From a medical supplies, that was probably the biggest thing that we were most worried about, along with the staff training, was, do we have enough supplies? And I'm very thankful every single day to the UW Medicine supply chain. They were able to give us the supplies that we need, the N95 masks, all the masks that we need, the personal protective equipment that we needed, the ventilator circuits that we needed to transport these type of patients. And we never had any sort of a glitch. It was amazing. Some of my leaders would go out to each base to be able to do daily PPE counts to be able to make sure that we had enough supplies from that side. So really coming together as a health system was key to our success at Airlift Northwest. The other piece was really just kind of coming down to how many patients we transport. Now, when we get called to a scene flight, which is with our EMS providers, with South King County Medic 1 or out up to Skagit Medic 1, we treat all patients as if they are going to have symptoms for COVID-19. And so what we end up doing is that we put on our PPE, we wear our masks to be able to make sure that we're protecting ourselves. So looking back at the data, we are transporting about 10% of our flight volume every single month are either suspected of having COVID-19 or are positive at the time of the pickup. And our operations are transporting patients from a scene or an accident or from the San Juan Islands or from a hospital, which is what we call an interfacility transport. And that's throughout the entire state of Washington. So what that rough number comes down to is that about 25 patients every single month during the pandemic, we have suspected of having COVID-19. And it's worked very, very well. Our operations up in Juneau have been the same. But we've done a very, very good job of supporting each hospital up in that area to actually find resources up there. But we take the patients wherever they need to be able to go, not only into the UW Medicine system, but to Virginia Mason, to Swedish, to Providence, to Sacred Heart, to Deaconess, to Confluence there in Wenatchee. So we go wherever we need to be, wherever we're called to be able to go. So in closing, just from an operations, we have not really changed anything. We are doing the exact same thing as we have done from the beginning of the pandemic, and we have found really, really good success. And I can't thank my team, my leadership team, and the flight nurses and pilots and mechanics for the success of this program and our response to the pandemic. So I'm really proud of them. So there's the last time. This was over the weekend, and this is a picture of our PC-12, our Pilatus, our fixed-wing aircraft that we fly here. And we were flying in the snow. Helicopters weren't flying at all during this time period, but this is where we were going. And in fact, a side story, we went to Brennan fire over the weekend, and we responded with this aircraft for a scene there to take a patient out of Brennan over to Seattle with a fixed wing. And that's not normally how we operate because we use the helicopters for that, but we can do it in this aircraft also.
And Jeff, you yourself are a flight nurse. Is that correct?
Yes. My background is actually I was a flight nurse. Still am considered a flight nurse. That was my training. I was worked with Airlift Northwest from 2000 to 2012 as a flight nurse. I've been a critical care nurse since 1996, and I started at UW Medical Center as a medical assistant and then moved up to the ICU onto Airlift Northwest.
Great. Thank you. That was great to hear. And thank you so much for all that work and keeping those patients, getting them where they needed to be and keeping them safe and your staff safe too. So we're going to go through our panelists as we always do, and then we'll take questions. So Dr. Anderson, I would love to hear from you about variants, what people should be doing to protect themselves. What are you seeing as this disease is evolving? How do we keep ourselves safe?
So as we, first of all, I'm Dr. Mike Anderson, the Chief Medical Officer for Virginia Mason Franciscan Health. And as we start to talk about the variants and what potential threat they could create for us, we certainly have to lead off with the efforts to vaccinate as many people as we can across the state of Washington. And indeed, Virginia Mason Franciscan Health has been looking at this issue well before we knew anything about COVID-19, in that each year we have prepared our staff through annual flu vaccination drills in which we basically set up our mass vaccination sites in anticipation of COVID-19 or any other pandemic that may require a vaccine. So we were all prepared for this in the middle of December. We certainly enacted those plans again and saw how we could serve King, Pierce, and Kitsap counties in providing as much vaccine as we were supplied. We're very proud of that fact that we have been able to deliver over 103 doses of vaccine since the middle of December. And when I say 103 doses, that includes both the first dose and second dose as appropriate. But we could not have been doing that or achieving that, which is we're now at a rate of just about 3,000 vaccinations a day. We would not have been able to achieve that without our volunteers that have come in to help us so that our staff could get back to their work taking care of COVID patients in the hospital. So how does this—
Dr. Anderson, you meant 103,000, right?
Oh, 103,000.
Yeah.
Correct.
Okay. Thank you.
Sorry. But how does that all play into when we look at the future and the potential effect from the variants that are out there? And certainly these vaccines were specifically tailored for the original variant of the COVID-19 virus. But as you would expect, especially coronavirus has a tendency to change. And certainly when it changes into a form that's more transmittable, it's going to take over and become the predominant strains or variants. And so we're watching this closely as we now know both the South African and the UK variant are here in the United States. We're watching to see how that might impact things. The good news is that all the medical literature that we've seen so far still says that there is protection that is created by the current vaccines. And therefore, we continue to join in with our public health departments and the State Department of Health to provide as many vaccine doses, to individuals that qualify based on the governor's program as we can, and we'll continue to be committed to that. But we also have to remember, as we start to experience a marked decline in the number of new COVID cases, not only being reported in Washington State, but across the country, we have to be careful not to let our guard down, because this may be the calm before the storm if these variants indeed grab hold and start to spread at a faster rate. Although the vaccines help significantly with reducing mortality and morbidity, it's going to be our common sense social distancing and use of masks. And now the CDC is starting to recommend double masking or use of mask fitters to help improve that seal that the mask creates. In addition to making sure that we're doing the hand washing and, like I said, the social distancing, not participating in large gatherings where perhaps masks are not being used. If we continue to do that, we'll continue to see the success that we've had so far, not just from our vaccination programs, but also from the decline in the number of cases from our social distancing and the use of masks. So again, Virginia Mason Franciscan Health is very proud of what they've been able to contribute to the communities, and we could not have done that without the help of our volunteers that have come back. After a year of really not having a volunteer program, we're pleased to see that the community has come out to support us as well as we go into this endeavor. So if there are any questions, I'm certainly willing to take questions.
Thank you. I think we'll keep going through our agenda. I also would let members of the media know, Dr. Scott Lindquist, you can see this, Scott Lindquist, who we think is fantastic, who is one of the infectious disease and epidemiologist folks at the Department of Health. He does a great demo of this, which is a tie and tuck, where you tie your mask and then you put it over your ears, and you can tuck the part in that, I'm going the right way. It makes it tighter, and then you can tuck the little place where it pulls forward, so you don't get that gap, which is the problem of these masks. So I might recommend, he does, and he also does a great demo of how you use a cloth mask over a surgical mask. The point of all of this is to keep the gap that shows up right here from a surgical mask from allowing virus in. But we told Dr. Lindquist that he was going to be a YouTube star with this great tutorial. And if he attends the DOH media briefings, it'd be great to get him to do the demo, because he does it very well. It's really speedy about it. But I think this notion of make sure you're wearing a mask, wear a better mask, consider a double mask, for sure not a bandana or a gaiter. They don't work well enough. You've got to have something more protective than that. So the next thing we wanted to go to, and then we'll take questions, is to share with you all, there's been a lot of talk about how do we ensure equity in vaccine delivery? And at the Hospital Association, we wanted to give to our members and other vaccine providers, this is information we're making public to anyone, some concrete tools for vaccine equity, and also a dashboard of how you can identify places that particularly should be focused on to achieve equity. So I am going to hopefully share my screen here. And I will show you all this document that we put together. So this is on our webpage. It's under the Strategies for Equity in COVID-19 Vaccine Distribution, so you can find it. And then it opens up a PDF. And so we are really pleased that the State Department of Health had a chance to review and comment on this document. So we thank them very much for their collaboration. But what this does is go through, how do you find the high-risk communities, and we'll show you our zip code and census tract data in a moment. Also noting that vaccine providers' own electronic health records can be a great place to identify people who are at risk, people of color, people over 75, people who are eligible for Medicaid, which is a proxy for income, or who are uninsured, or over the age of 65 with significant comorbidities, people with disabilities, or limited English proficiency. And then goes on to recommend a number of, let's see, I'm trying to figure out how I can make this scroll. A number of partners that one could find to work with. Really notes that it's that we have to acknowledge and address vaccine hesitancy that can be rooted in systemic inequities and historic medical harm. Provide some resources of organizations to work with, and urges vaccine providers to consider compensating or contracting with these organizations for their help identifying community members. And then some of the specific strategies are that you can reserve in your vaccine clinic, and this has been, the Department of Health has signed off on this. You could say, we are going to have a vaccine clinic just for people in zip code 98118, because we've looked at the zip code information, and that is a very diverse, fairly low income zip code. And so we're offering a clinic that's just for people in that zip code. You can only reserve from that zip code. Or you could partner with a church that's located, or a mosque that's located in a low-income neighborhood, and offer them advanced scheduling links. We're going to be having a clinic next week. You can work with we're going to give you all 48 hours advance on the appointments. You can work on getting your participants enrolled. Looking at school data, we've got the free reduced price meal by school list available as well. And you could reach out to the school leadership and have them invite their, again, with a special link, invite their family members who are currently eligible to sign up. Some strategies around mobile clinics, which you see on the screen here. There's a lot of really exciting work happening in mobile clinics. We featured some of this a couple of weeks ago. Thinking about how do you address accessibility for people who have trouble walking or can't stand in the cold for a long time. How do you create non-electronic scheduling options? One of the things that's really contributed to the inequity in vaccine delivery is, do you have access to fast technology, and are you proficient at technology? And especially in this phase, that can really disadvantage the older people or folks who've got cognitive or memory issues. I'll say I had to do all the scheduling for my dad, who's got Parkinson's disease. He had been emailed links and he couldn't figure it out. So I think that's probably quite common for people who are older or have any kind of cognitive challenges. And also urging that people make calls out to folks once you've identified them off your vaccine wait list or your electronic health record, that you call out to people in certain zip codes. Or you send navigators to high impact locations with a laptop that sign people up for you could send a navigator to a community center, register people for appointments for vaccine, give them cards that say specifically about where to go and when, and they're able to go there. Reserving some appointments for people to call out to them, but also reserving appointments for people to call in. I have a whole section on how to address people with disabilities. How do you think about how are you interacting with people who are hard of hearing or deaf? Do you need an ASL interpreter? How does your signage work? Very clear that immigrants are welcome. There have been some states that have said they will not vaccinate immigrants. That is not the case in Washington State. That our governor has been very strong on this point, as have the hospitals. That is absolutely not a requirement. So I think we need to be really explicit about that in the state, because there has been this message across the country that if you are an immigrant, you may not be vaccinated in some states. So we want to be very proactive about that. Thinking about community-based volunteers, there's a lot of enthusiasm for volunteering in vaccination clinics right now. And so to find volunteers from the communities you're trying to reach, and so that there's a friendly face and a community connection. An extra dose plan, that if you have extra doses or you have a mechanical failure, that you've got a plan to provide those extra doses to organizations that can reach hardest to reach organizations. So those are some of the things that we have outlined. Again, these are, I think there is some nervousness among vaccine providers about could you really reserve vaccine slots just for certain zip codes, or could you really reserve vaccine slots just for folks who are going to a food bank? And the Department of Health, as I said, has reviewed this and provided great comments and is supportive of it. So I think it's very clear direction about what people can do. And I'm going to ask Albert Froling, who is one of the leaders in our data team, to share the dashboard that he created to help people find the zip codes that we're talking about. It's one thing to say, go find the zip codes. It's another to be able to actually have a tool to do that. So Albert, I'm going to turn it over to you, and I'll stop sharing my screen so you can share yours.
Thank you very much, Cassie. I will share my screen, and that should work. All right, so here at WSHA, we came together and we wanted to help organizations deliver vaccines in an equitable way based upon their custom geographies. Not all, hospitals or vaccine providers, fall on, distinctly in a county or in a region. They may border some areas. So we wanted to give a quick way for these organizations to find their area and find regions that they can deliver the vaccine in a more equitable way. So here I'm on our WSHA website, going to go to our coronavirus resources. And here we have our coronavirus vaccine equity dashboard. So I'm going to click into that. And I'm going to wait till it loads. And I'll make it full screen here in a second. All right, so just to quickly orient you to this dashboard, we have all the counties within Washington State, and they are colored by the different coronavirus vaccine phases or regions. So here is Puget Sound, highlighted in that darker green, and we have others like the Southwest down here. And we have, again, the boundaries pretty clear here, but underneath this is all of the geographical data. So right now we have it defaulted to census tract. We can also flip this to zip code pretty easily, and it will filter down the dashboard to this geography. We'll go back to census tract, and I'll give you a little bit of information on this dashboard. We can scroll over this information icon to see that. So it has the purpose. The data behind this is the American Community Survey, which is the premier data source for demographic and household information in the US. It's located on data.census.gov, and it's the 2015 through 2019 version. So what's behind this? Some of the measures that we're looking at is the percent BIPOC population, percent non-English speaking, median household income, and then percent disability. We have an equity focus score, which I will go over in a little bit. And then a quick overview on the geographic definitions. So a lot of times we think of populations as they associate to a zip code. And here we're using a zip code tabulation area, which is pretty close. But one thing with zip codes is they're used to deliver mail. They don't necessarily follow different populations very well. So we're using also census tracts, which get down to a more granular level. There's about 2,000 census tracts within Washington State compared to 600 zip code tabulation areas. And each of these has about 4,000 people. So let's say we are a provider that's located in South King County. So we could filter down our dashboard to the Puget Sound region. And we'll have Snohomish, King, and Pierce County on the screen. And if you're in South King County, like let's say you're a smaller provider, you really don't see people from Snohomish County very often. So we will also filter out Snohomish County. So here we have King and Pierce, but let's say you don't really see people from Northern King County or Southern Pierce either. So we want to give people the flexibility to select an area that actually for patients that they actually see. So I'm going to click and drag this area here. So again, let's say we're a provider in South King County. We see some people from Northern Pierce, Southern King County, and I've selected this region, and it's automatically going to take us to the next screen. This is where the real analysis happens. So I'm going to zoom in here a little bit. And so this is the area that we selected. Has about a population of 626,000 individuals. You could see a little bit more information, about 14% 65 and older. And we have an equity focus score here. So the darker the shade of blue is the area that you should focus more on equitable vaccine delivery. And the way that we calculate this is we take a percentile ranking of each of the measures of BIPOC, non-English speaking, median household income, and disability. We rank all the zip codes within the state. We add up those 4 measures and then rank it again. So you'll see that the areas, whether it's a zip code or census tract, from what you've selected on the previous screen, you'll see that the more disadvantaged or the places that you should focus for your equity efforts in the darker blue or more near 100. And you can see some more information about these areas as well. And you can kind of see that it follows the I-5 corridor here. You'll see that darker shade of blue. So like this specific census tract has an equity focus score of 99 out of 100. Down here, you have some aggregate statistics where it says selected area equity statistics. So for our area, it's 40% BIPOC, Black, Indigenous, and people of color. 23% are non-English speaking at home for the population that's 5 years and older. The median household income is $74,000 a year, and it's the population has a 12% disability. We can also see more of a breakdown if we hover over each of these visualizations here. So we could see that it's 62% white. The next largest race and ethnicity is Asian, followed by Hispanic or Latino and other. We can do the same for percent non-English speaking. Like let's say you wanted to provide interpreter services at one of these sites. What is your predominant language? So that can help you identify that. You can look at a distribution of the median household income. We have 18% making under $35,000 per year. And then just a quick statistic on the percent disability. So let's say, you want to learn more about maybe some specific areas within the area that you selected to kind of target your vaccine distribution efforts in an equitable way. So we took all of these geographies, these census tracts, and we sorted them by the highest equity focus score to the lowest equity focus score. And you can see here that this census tract within King County, kind of near the Federal Way, looks like Highway 18 area, 62% BIPOC, 32% non-English speaking, under $40,000 median household income, and a 23% disability. And for these zip codes as well, you could see a breakdown of the distribution of each of these zip codes. And we can scroll to another to see more information. What's also great is we can select these, and let's say you wanted to focus your efforts on places that were pretty close together, but that were also, in a place that you want to focus for vaccine equity. So we could select this census tract. We can also select the other two at the top, which they all seem kind of like in the same area, just east of Federal Way. And not only will it highlight those 3 census tracts, but it will also recalculate these selected area aggregate statistics as well. So for this population here, just east of Federal Way, it looks, just north of Highway 18 Northwest, it looks, like there's 64% BIPOC population. We have 40% non-English speakers. And you can see the median household income of $48,000 per year. And then I guess one last thing I will show you with the dashboard is, we do have some how to use the dashboard videos. So if you, are curious about how to use them, you can go down there and select a video. So, yep, that concludes my demo.
Thank you, Albert. So as we said, we created this for the use of our members, but we are making it public for anyone to use in the equity strategies. And we hope that many other vaccine providers will find it useful as they're thinking about where to locate their clinics, how to reach out to organizations, really the point of it is that any vaccine provider can go in and look at their community and identify the zip code, for example, where they want to target or invite people to come get vaccinated, and then say, we're going to be having a vaccine clinic just for the zip code for the weekend, or they might cite a mobile clinic in that location. So we hope that everyone will use it. We hope that, we've got pharmacies and grocery stores and mass vaccination clinics, and we want it to be available to anyone to use however they would like to. And those are that is the presentations that we had today. We do have a few questions that have come in, one of which I'm very happy. Someone said, what are tools for people to work on equity in vaccines? So we were able to address that. We're glad that we had that in our briefing today before we started. I'm actually just looking through the questions. Okay, there's questions about the masks, the counterfeit masks. So yes, we believe we're still in competition with 3M and Homeland Security. We believe that there are about 2 million counterfeit masks in the state. They have all been pulled off the shelves. It looks like about 40 hospitals had them. Mostly they had not been used. They are being tested right now. Some other states also had counterfeit masks. We don't know if we have the same counterfeiter. So that's a problem. We're not sure if our counterfeits are the same as other people's counterfeits. Probably they are. And they have been found so far to be good masks, which is interesting. Both the UW and Multicare have sent the masks out for testing, and we'll be getting those responses back this week. What we understand from Homeland Security is that they plan to confiscate them, even if they are safe and effective masks. We're not 100% sure about that, but that sounds like that's going to be the case. So we've appreciated very much the partnership with 3M and Homeland Security and with our hospitals who so quickly reacted and got these masks pulled. It's rather horrifying to have bought these masks. They were about $4 a piece. So the Hospital Association spent $1.4 million on them, about $8 million totally across the state. 3M has expedited an order from the Hospital Association directly to 3M. It's not through a distributor, of about 1 million masks. We're expecting to receive those by the end of this month, starting the end of this month, and then moving into next month. But hopefully they'll all be here by mid to late March to help shore up the supplies that have been pulled off the shelves in hospitals around the state. Question about President Biden tweeted this week he anticipates the country will break through his goal of 100 million vaccinations in his first 100 days. Yes, for sure. I think we're past it already, actually, with the way they were going. We've seen closed sites due to lack of supply and canceled appointments in other areas for the same reason. I think if there's the supply, the supply is getting used in this state as fast as it comes. As I mentioned at the beginning, I don't know if some folks heard this or not, that there's some snow delays in delivery, especially of Moderna this week. But we are expecting a lot more vaccine next week and are excited about that there'll be more vaccine in the state. We are hopeful that the amount of vaccine will keep going up. That's what we understand from the Biden administration. There is, at this point, the infrastructure in this state is built to deliver a lot more vaccines than we are currently delivering. We just need the vaccines. And I think everyone on this call, every panelist that we've ever had is eager to vaccinate more people, as are pharmacies, community clinics, everybody. So as long as if the supply can get here, we'll use it. Johnson & Johnson coming will be a really big deal if that happens, because it is easier to transport and it only requires one shot. I think this is something we've wanted to remind people of repeatedly, that 200,000 doses of Moderna vaccinates 100,000 people. 200,000 doses of Johnson & Johnson vaccinates 200,000 people. So it really does, will accelerate pretty quickly. So we're excited about that. Let's see. Questions about first doses and second doses. We believe that the second dose backfilling will be largely complete this week. And the good news about the first dose, second dose confusion is there's a whole lot more people who are going to be fully vaccinated faster. And so we're going to be, this week will be ahead, I think, of other states in full vaccinations. I think there was confusion, but it's going to be resolved. And I think moving forward, there'll be a lot more first dose appointments next week. Another question, are hospitals expecting to receive Johnson & Johnson? I don't think so. So hospitals are the most equipped, and Dr. Anderson, please jump in here. Hospitals are most equipped to handle Pfizer. They can handle all of them, I should say that beginning. Hospitals can handle any of these vaccines. Of vaccine providers that can handle Pfizer, hospitals are the most equipped because hospitals are most likely to have the ultra cold storage. Moderna, so Pfizer is hardest to handle. Moderna is second hardest and still kind of hard. Hospitals can definitely handle Moderna. So you need to have ultra cold storage and constant digital thermometers for both of those. Johnson & Johnson storage requirements are much easier. So we expect, we don't know this for sure, it's a good question for DOH. We expect that Johnson & Johnson will be more largely distributed to community providers who don't have access to ultra cold storage. That's our prediction. So Dr. Anderson, please jump in about what you see coming forward in the storage and how J&J will be handled.
So I absolutely agree with your assessment that because of its ease of storage and ability to be moved into those very isolated places, I would expect that would be the prioritization for the J&J vaccine. Now, we do have not only the storage capabilities for the ultra cold storage, but also for Moderna. But as a large system, we also have the IT resources to coordinate that second dose and to bring people back for their second dose. So again, those are the predominant reasons why we may see Johnson & Johnson go out to other locations than the hospital systems in the larger cities.
And I think this would also be a good question to ask Department of Health, but they were contemplating really having hospitals concentrate on Pfizer as the vaccine supply increases of all the different kinds of vaccine that hospitals would be largely, not exclusively, largely Pfizer sites. Maybe some of the community clinics might be more Moderna sites, and then maybe pharmacies and mobile clinics would be Johnson & Johnson. So that's just, and again, please confirm that with them. They're in charge of allocations, but that's what we had anticipated. Another question, do we expect Johnson & Johnson to be prioritized to certain populations like younger people? I have not heard that. Dr. Anderson, have you heard that?
No, in fact, I've been waiting to see some studies about pediatric patients come out. So I have not yet heard that any study is going to be released soon. I know it's being conducted, but we're anxiously awaiting those reports.
Is J&J testing on pediatric patients, or is it just Pfizer that's doing that right now? Do you know?
I can't say for sure. I thought J&J was, but I'm not going to.
Okay, I don't know either. I know there are some pediatric trials happening, and I believe Pfizer is for sure. I think the Pfizer pediatric trial is fully enrolled. You all should check that fact. Don't use me as a source on that because I'm trying to remember all these different vaccine facts. But I don't know about Moderna and J&J about whether they're being tested on kids. How are hospitals handling the vaccine delays due to snow this week is another question. So there's two kinds of delays that happen. One is easier than the other. So the first one is that we had snow, and so some clinics were canceled or rescheduled, and I think that's gone fine. Most of the clinics kept going. People wanted to come. We asked people to cancel their appointments if they could not make it. But what I understand is there were very few cancellations. Dr. Anderson, did you all have cancellations at Virginia Mason Franciscan?
No.
No.
Although we're always concerned about our patients and how they have to get to the vaccination sites. But Yeah, very little, very few cancellations.
Yep. And we did share that message to say you'll be rescheduled if you don't come, and we'd rather you stay home and be safe and come in 2 days, but people really wanted to come. And I think that was true around the state. There were some clinics that were canceled, so some people did get rescheduled. So our snow has been easy to deal with, and all those folks have, I shouldn't say all, most or all of those folks have either got their appointments or they got rescheduled. The worrisome delay that we're having right now is we don't know when the vaccine is going to come. Some of the vaccine deliveries are delayed that are being counted on for appointments this week. And so, as I said, the CDC is supposed to make some announcements about this afternoon. We haven't gotten them yet, but I know it seems like Moderna especially is delayed, and we're just kind of hearing this because the deliveries this is the window and deliveries should be arriving. Dr. Anderson, do you all have delays in your vaccine receipts this week?
So we normally hear about second dose allocations on Thursdays and then first dose allocations on Fridays. So tomorrow's a big day to hear whether or not there are going to be some significant delays.
And did all the vaccine you were expecting this week that came on Monday and Tuesday, did it arrive? Do you know?
Yes, we have an allocation, and we've continued to meet our obligations for our appointed patients this week.
Great. But I think I know that there's been some movement of vaccines. Some folks received theirs and others did not. And so there's been a lot of intra-hospital movement of vaccine to cover yesterday and today. But I think that's going to be challenging I think there's probably not a lot more to move. So hopefully it's going to come today or tomorrow. Allison, do you have a question for Jeff, it looks like?
I do. I wondered if a lot of his audio was underneath his PowerPoint, which was very helpful, but we'd love to have you on camera talking a little bit more about the added challenge of transporting COVID patients. I can't imagine doing that medical care in the air, and then you add on the necessary added PPE, the challenges of breathing these patients. Tell us more what that's like, please.
Yeah, no, I think that, I can put myself in the flight nurses that are doing this as a former flight nurse is that the challenge of it is just making sure that that you've got all this equipment on you, and usually you can be hot at the time, and you're just making sure that you've got everything accessed. The nice thing is that when we go and package a patient for transport, either at a hospital or at a scene with the fire department, that we put all our equipment on the patient, so that all we have to do is plug them into our LifePak 15, or all their medication, their IVs are all coming out of what we call this packaging. We call it, actually, it's called the burn pack, but it's not for burn patients. It's actually just what we call it to keep the patient warm. And so it's really kind of plug and play to be able to do things. And then if we need to be able to have an intervention, we just move things around, and we've got gloves on, and we change our gloves in the safest way possible to be able to take care of the patient. I find that as a flight nurse, and for all the flight nurses that are out there, is that we're very adaptable in small spaces. I would always have extra equipment in my pockets of my flight suit, so that if I drop something, I would actually just reach down to my pocket, like a syringe or something like that. So those are some of the challenges that happen in the helicopter, because particularly in Seattle and Western Washington, when it rains, you're wet, and then all of a sudden everything is fogging up. So we even provide simple things as anti-fog wipes that you would use on the ski slopes to be able to make sure that you could see what you're doing. So those are some of the many challenges that you adapt to as a flight nurse.
Thanks, Jeff. I think we're through all the questions. Unless anyone, please feel free to unmute yourself and ask a question orally or send something into the chat. Yeah.
I actually had a question. I wanted to know how you're all working with the All in WA organization. I heard that they're opening up grants just for vaccine equity within communities. Are you aware of that?
I am aware of it. They, I believe they're in the fundraising part of the stage. I'm aware of it and I'm excited about it. I honestly don't know enough about, I think it's just formed, and I don't think we have information yet about how organizations might apply.
Okay.
I was thinking about it as we were working on the equity document and thinking, one of the suggestions that we make is vaccine providers could compensate or could figure out a way, not necessarily the vaccine providers, figure out a way to have a community partner be compensated for their time identifying participants for vaccination, scheduling them, day of support, even translation services. So, that could be a great partnership where the hospital shows up with the vaccine to a food bank during their food bank distribution hours. And the food bank has received a grant through the All-in-WA for their time to get it set up on their end and to get all the participants lined up and all, forms filled out and all those kinds of pieces so that it would run really smoothly. So I was imagining that potential kind of partnership, I think.
And then I know you touched on this a little bit, but I just wanted to ask the question directly. So Governor Inslee had said that 3.6% of the state's Hispanic population was eligible for the vaccine, but only 2.5% have been vaccinated. Why do you think that is, or what's contributing to that disparity?
Well, I think I'd like to answer the question about what are some tools that we can do to address that disparity. And I think some of the pieces about finding the locations where you can site a vaccine clinic, using the tool that we've described, a dashboard that we showed you, doing call outs for scheduling or allowing people to call in to schedule rather than an online tool. I think that access to strong, fast Wi-Fi is real differential across our state, good broadband. And mobile clinics, translation services, and also the immigration message, I think is a really important one. I'm honestly horrified that some states say you can't be vaccinated in our state if you're an immigrant. That doesn't make any sense to me at all. And so I'm concerned that message has gotten out and that people might think if they go to a immunization site that they're going to, somehow it's going to compromise their immigration status. We have opposed public charge rules for years that say that you can't become a citizen of this country if you use any public benefits. Those rules exist and people are worried about them. And so I think they're worried that there could be worries that getting a vaccine could create a public charge. If I can explain that more if folks understand what that is, but basically a public charge if you use any public benefits and then you're like dependent on the state. That's the theory of it. I don't agree with it. And so you can't become a citizen. So I don't know if there's that worry, but I think really head on addressing that immigration is not a consideration and that no information will be shared with immigration authorities. Absolutely. And it will not create a public charge. It will not affect someone's ability to receive other benefits or to become a citizen of this country.
Thank you.
I think another thing I would note is one of the clinics that we had the great good fortune of being involved in at the Hospital Association was a Swedish mobile clinic where they partnered with a Catholic church in South Seattle. It was largely Latinx population. And the priests were really important in encouraging parish members to show up and also in helping provide that information about this is not going to be an immigration issue for you. So it's, that was a great example of finding a very trusted community partner, sort of leaning in with them and having them help lead the way. Albert, there's a question for you. Let's see. Now that we've given, maybe it's a question for me actually, because I think you were showing the tool. Now that we've given providers tools to find communities in need, is there anything we're doing to assist providers to reach them, or is it up to those to seek out communities using this information? We have a lot of tools there. We have a lot of lists of the kind, we have the USDA food bank lists. We have the free reduced price meals, school data and contact information. Recommend that people go, think about churches in those communities. I think it really is going to be up to them to seek out those communities using that information. We wanted to give people the tools to get started. And then we don't have comprehensive lists of every organization that's operating in those cities, in those areas. But, it's really going to be, how do you find the community partners and really lead with them?